Thank you, Devin. And with ice and snow and slush outside and to come, it may have people cautious when looking for some sure footing. But today, we take a look at the people who are at the greatest risk for falls with or without the ice. Here to talk with us about that this morning is Nurse Christina Paris. Thanks for joining us this morning.
Yes, I mean, of course, it's appropriate with today's upcoming snow and slush and this morning's ice.
Exactly. It's it's springtime, wintertime in the Northwoods, so it's incredibly applicable.
Yeah.
So tell us a little bit this morning about who's at the greatest risk for falls.
So for general falls, if you're thinking year round, it's going to be people typically over the age of 65. 1 in 4 people will fall, leading to 41,000 deaths, according to the CDC. Yeah. So it's mostly older people, especially people who are not as strong, or more sedentary. Yeah, so risk factors, like I said, advanced age. If you've had previous falls, so we'll have calls about patients who fall continuously.
Okay.
They give it the old college try, but just are struggling to maintain that.
I hear from friends and grandparents, the grandparents of my friends, and it's when it comes when they least expect it sometimes, and it's just they're just trying to do too much. And they just they just don't think about the little process and steps of it.
Right.
And it's just, when that happens, then it snowballs into a bunch of problems.
Well, that and some medications. So if you're making a quick move, you can lose your balance easy depending on what medications that you're taking.
Right.
But other risk factors, just are muscle weakness. So, gait and balance problems, poor vision can cause and put people at higher risk. Postural hypotension, so that can occur when with medications. So going from like sitting to standing or laying to sitting, you get kind of dizzy, can put you at risk. Just having a fear of falls can make people so anxious that they're
it's a shame when that happens. You get so afraid of something, and then you just create that the result that you're afraid of happening to begin with.
Right, and then just obstacles in your house, slippery or uneven surfaces, and then improper use of assisted devices. So sometimes people who use walkers will walk way out of their walker, so they're not using it appropriately and keeping it close to their hips. So that puts you at a higher risk too.
Right, you got to use the devices appropriately and how they're designed to be used. Just like medication, you follow the prescription.
Yeah.
So you follow, stay within the walker there. So can you give us some tips to help prevent the falls and what to do if we experience them?
Yeah, absolutely. So you want to prevent falls by, making your home a little safer. So you want to get things like non-slip rugs, move furniture, electrical cords, clutter, loose rugs. You can add grab bars to like your bathrooms. That can all be helpful. Even lighting. So having good lighting on your stairs, the top and bottom of your stairs can be helpful as well. And here where we live, a lot of us have wooden floors because they're cabins, they're older, or even just that wood laminate. So that's really slippery if you are going on a day like today where you're gonna get wet and then come inside. And so we have these little rugs that we put all over our house, but those little rugs can slip and move, and so that puts people at fall. So you should also get a routine physical, making sure that you're in tip-top shape, both getting your eyes checked as well as your body. Non-slippery shoes and socks can help, just making sure that you're taking vitamin D, so building up those bones, staying active, using your cane, walker, other safety devices, and post-surgical people. If you are recovering from a total knee or a total hip or a shoulder surgery, and you're on those medications, you want to be really careful about that. And sometimes it just happens. A few summers ago, you may remember I fell jumping onto a dock and broke my arm. So
I do.
It can happen to any of us, healthy or not.
Exactly. And I took a tumble on the ski hill a couple winters ago. I think 3 winters ago, and Yeah, it happens to literally everyone, you know, certainly not on purpose. No one's trying to fall.
No.
So it's always good just to be cautious, you know, help yourself so you don't fall again.
Right, absolutely. And if you do think you have injuries, make sure you go in and get it checked out.
Absolutely. Well, thanks for taking the time this morning. Hopefully everyone can stay upright. We've got, you know, another week of winter weather, so there's lots to look out for, but, you know, all year round, it's a good idea to be on our 2 feet.
Absolutely.